Hey, tell me where you live.
I live in a little small town, Anderson, Alabama.
Yeah, so it's about 60 miles east of Birmingham.
Yeah, about 60, 65 miles from Birmingham.
Yeah, okay, and you've been there most of your life.
All my life.
Okay, what kind of work did you do?
Well, I did forklift operator. I worked in a chemical company and they called it a warehouse operator.
Yeah.
And I did numerous things. I drove forklifts, load trucks, filled 55-gallon drums, a little bit of everything.
A little bit of everything.
Yes.
Your family's there?
Yes.
Your wife and children are there?
Right.
Okay, good. I appreciate you being here today.
Thank you for having me.
It's my pleasure. You honor us by being here. First of all, your story starts really before the COVID. And let's go back to when you had a kidney transplant. How far back was that?
The kidney transplant was in 2013, September the 27th.
Okay, and did that go pretty smoothly for you?
Oh, it went great, yes.
And you'd been on dialysis for how many years prior to that?
None.
None?
I have
So you went directly from, you never had to go to dialysis.
Until I caught COVID.
Until you got the COVID. I know you lost your kidneys recently during that. But so from that time between 2013 of your transplant until the diagnosis of COVID, which was in February of this year, February 2021.
Right.
Had you had any problems with the kidney?
No.
And so you were on standard regimen of rejection medication.
Right.
Okay. And nothing had changed.
No.
Okay. And you were taking triple medication, I think, right? You were taking the Prograf and the mycophenolate and prednisone.
That's right.
How much prednisone were you on? Do you recall?
When I first started, got out the hospital from doing, I was taking, I think it was 3.
Yeah.
And then I started feeling kind of bad or whatever. And I talked to Miss Darnell and Dr. Kumar, and they dropped it down to 1.
Okay.
And I've been on 1 ever since.
Ever since, like for years?
It's for years, yes.
Okay, good. So that's 5 milligrams a day. That's not much at all.
Right.
Okay, good. And your life function has been good too.
Yes.
Okay. You're very, very functional. How old are you?
I'll be 64 in December.
Yeah, you're younger than your age.
Yeah.
Let's just say that. Let's just say you're younger than you have good genes. So let's go to your episode of COVID. You came in early February.
Yes.
And what brought you in?
Well, I was at work and I was working with a guy, and we had practiced safe distance. And like I said, I run the forklift, so I was up and down on the floor, moving, drilling around. But anyway, we like 6 feet apart, no matter what we were doing. But where I figured I probably got it from maybe from the break room. Well, but long story short, I was at work on a Wednesday afternoon, and the guy I was working with that day, he said that he wasn't feeling great. And he told me he was going to go ask the supervisor, can he go home or tell him he wasn't feeling well. So the supervisor told him, you need to go take a test because, like I said, COVID and all that. Yeah. So he went to the test, and he came to work that Thursday and told them that he had tested positive. Okay. So they knew I had worked with him the day before, and they come and got me and asked me how I was feeling. Well, at the time, I was feeling good. Wasn't feeling nothing. And then he said, well, you need to go take your test. And I went to the test and ended up being positive. And from that Thursday evening or Friday morning, whenever I took the test, that weekend I got so sick. Yeah. And I got really sick, like I said, during that weekend, and I had to go to the hospital. Yeah.
So it wasn't long after that you showed up here.
Yes.
Now this is early February, and so vaccinations were only they're pretty scarce. They weren't available to everybody. Had you received your vaccination yet, or were they even offering vaccinations to the?
They weren't offering it in.
Yeah. So at that time, the transplant population, we knew they were going to need to be vaccinated, but they weren't offering it to them at that time. Have you been vaccinated since then?
Yes.
Okay. 2 times?
2 times.
Give me 5.
I'm waiting on my third. I'm waiting for a booster.
Okay, wait for that booster. Okay, we're all waiting for the booster. All right. All right, so you were admitted when you showed up at the hospital. They didn't send you home. You were directly admitted, I believe. You were sick enough that you came in directly.
If I can get it right, when I came over here, I started feeling really, really bad, and they was telling me to come on and go with them, like stand up. Well, I was sitting outside. They said, "Come on." I said, "I can't." Yeah. She said, "What do you mean I can't?" I said, "I'm gonna need a wheelchair. I can't."
So you're that weak. You were that weak. You couldn't even stand up.
I couldn't even stand up.
Okay.
And so when I got down, they said, "We're gonna take you down to the emergency room." Took me down to the emergency room. When I got down, they started running these tests and found out that my blood had dropped to 30.
Yeah.
And then after that, they admitted me. And then they said, "Okay, well, you got to come." And then they started doing all that
all
stuff.
right. So during your hospitalization, you never were put on a ventilator, but you were quite ill. You were on the floor, but you never were put in the intensive care unit, if I recall that correctly. Is that your recollection?
You're correct.
Okay. They did give you the steroids, and they gave you remdesivir to combat the COVID. And then things started to happen too. Other things started to happen. You developed a rash on your side.
What I had with the rash, when I was at Regional Medical Center where I first got admitted,
okay,
I had got up to try to go to the bathroom, and I fell. And after I fell, I thought everything was good. In about 3 days or 2 days after that, I got a big old rash and swole was on my left side. And then they didn't do nothing about it up there. I guess they didn't really know it was a bad way. I didn't stay long enough. I guess after I got healed, they figured out what it was.
Okay.
And disease.
Yeah. And so you developed COVID, and then a few days later, you have this thing show up on your side.
Right.
Okay. It was painful?
Not really.
Itchy?
Kind of itchy, kind of.
Okay. But it wasn't. But it was certainly not normal.
No.
And it had come up fairly suddenly.
Right.
Now, you came here, and they biopsied that and found, because they didn't really know what it was. They thought it might have been a viral infection.
Right.
It had the appearance kind of almost of shingles. I think they might have mentioned that to you as well. But then they determined that it was, in fact, a fungal infection and called Cryptococcosis. And they learned that from the biopsy. They did a biopsy, and they always saw in that skin biopsy was loads and loads of yeast.
Yes. And
that prompted them to get blood cultures and then some other diagnostic tests, which demonstrated that you had this yeast not only on your skin but in your bloodstream.
Right.
And they did a lumbar puncture, a spinal tap, which fortunately was negative. So they didn't have to go there.
Right.
Which is really good news for you. So then, what do you recall about your hospitalization? And I'll if you things that you don't recall, I'll try to fill in the blanks. But what do you recall? Is it all a blur now, or do you remember something?
Yeah, really not much. I couldn't recall a lot. The only thing I know, I was in pain and just really, really sick.
Yeah.
And
where was the pain? Where's the pain?
It was just about
all over. Just all over.
Yes, just about all over. And all my doctors have come in and see me for different things. They were saying they don't even know how I'm even here.
Yeah.
You know, say I should. They said, like I should have died, but possibly I supposed to be dead. That's what they're saying.
Yeah, you're quite sick. I mean, for a man who didn't make it to the unit and didn't get on a ventilator, you're about as close to it as a person comes.
Right.
All right. Well, you had, during your hospitalization, you received not only the treatment for the COVID, but you also received treatment for this complicated fungal infection. You got IV amphotericin, which is really rough on your system.
See, I had pneumonia too.
You had pneumonia. That was probably due to the COVID, and it could have been due to the crypto. But the other complication you suffered was you got this amphotericin, you dropped your blood pressure, you lost your kidneys for a while. That precious kidney, that transplanted kidney that had served you so well for 8 years was now gone,
right? And
you ended up on dialysis for some time.
That's right.
And I think
6 weeks.
Yeah, and I think the general assumption was that was going to go too, but miraculously, your kidney function has turned around, and now you're running a creatinine of 2. You're in the 2s, 2.2, I think today.
Yes.
So that's excellent. So how are you doing now?
Well, I'm doing fine. Like I said, I do really well. Just have shortness of breath. Dr. Kumar just told me he believes some blood loss or something. They're going to try to find out what it is.
Yeah. Right now you're suffering. Right now you're developing some anemia. They don't understand quite why that is.
Okay.
I mean, and we're now 7 months after the fact, so we're well out from your episode of crypto, but we're still treating you from the crypto. Okay. So you're still taking the oral fluconazole,
right? And
that seems to be working well. You seem to be tolerating that okay.
Mm-hmm.
We've had no recurrence of fever.
No,
nothing like that.
No.
Okay, and so things are actually going well. Our plan's going to be to treat you for about a year with the fluconazole.
Okay.
And I should say that your rash has almost gone away. In fact, it pretty much has gone away.
Yeah, I don't feel anything.
All that's left now is just a little bit of scarring, and there's not much left to it right now. So I think we're gonna do fine. But you had a close call. You had a really close call. I'm telling you. So I think the lessons here are that COVID. We've certainly seen a lot of COVID in our transplant recipients. It oftentimes is complicated. We have seen this complication, that is cryptococcal disease or cryptococcosis, occurring in a number of these. We have 6 or 7 patients like you who've had cryptococcus. Most of them have had meningitis. You're the only one that I'm aware of that's had cutaneous disease. And thankfully, all have done okay. All have survived, and all are doing, okay on the fluconazole now.
Yes.
But you had a tough time.
It was
from the beginning of this. I'm sorry. Well, I guess I'm glad you can't recall it, because most people, if they could recall their hospitalization, they may have a stroke or something. It's
the only thing I recall is the time.
Yeah, just being here,
Yes, okay.
Yeah, and having people poke you every day and ask you the same questions.
Right.
Okay. Is there anything else you want to share?
I mean, no, I was just, I'm glad that I was at UAB instead of anywhere else, because I trust UAB.
Yeah.
And so I always tell my wife, if anything happens, drastically, or if you think I can make the UAB do what I want to be.
Okay.
Because the people here, they treat me real well, and do really good.
Well, that's a good plug for UAB. You should tell the whole world, if they get sick, this is where they need to be. No,
I think so. I think
no, thank you. Well, thank you. This has been really helpful. Mm-hmm. And I think it's instructive to other people. You dealt with COVID. You got over it. Mm-hmm. You had a complication. You got over that.
Right.
And we're just at this point we're just trying to clean up the residual effects of that fungus, and then kind of work up this anemia, which is not really related to any of this at this point. Okay. Anyway, thank you so much for your time.
Well, I'm glad I could be able to do it if I can help anybody in a way, because I wish this now nobody. I mean, this COVID ain't no.
No, it ain't no game.
It ain't nothing to play with.
No, it ain't no game.
And all the people that don't want to take the shots and don't believe in it, I'm a living witness is here and you don't want it.
Yeah, amen. Amen to that. Okay, my friend, thank you so much.
Thank you so much.